day. But this one glimmer of good news in Los Angeles County, which has been so hard hit by coronavirus. Reporting from Los Angeles, I'm Paul Verkaman. Now back to you.
Infectious disease expert Dr. Stephen Parodi joins me now from San Francisco, California. He's the Associate Executive Director of the Permanente Medical Group at Kaiser Permanente. Thank you so much for joining me again. We just heard the catastrophic situation in LA County, the situation, terrible across the state, as you well know. You help oversee some 21 hospitals, 4.5 million patients. What are you seeing on the ground there?
Yeah, it is very busy right now. We have over 3,000 hospitalized COVID patients, 650 are in the ICU, and it's time to put this to a stop. And the mobilization efforts for mass vaccination are critical right now. We're deeply involved with it. Numerous other health systems are involved, and this is really going to take all hands on deck to put a stop to this pandemic.
Yeah, that's what I want to get to. The national vaccine rollout has been widely criticized as a disaster. Your hospital's part of, or your system is part of a huge vaccination effort. I saw on your website that, your phone centers are overwhelmed with calls about the vaccine. I understand you don't have enough vaccine supply to meet the demand, and you're not alone. The federal government, expanded the list of people eligible to everyone over 65, but didn't increase the shipments of the vaccine. So how are you coping with this, and do you expect to run out?
So we've actually been matching the supply to demand as best as possible. We're working with the state and actually the federal government to inform them about how much we do need. But in the meantime, we're asking people and actually proactively outreaching people to wait. And this is actually providing us with some time to set up those mass vac sites. As you referenced actually in the earlier report, it takes a whole ton of logistics to put this together. So we're working and taking that time to be ready for when that vaccine is going to be coming in the next few weeks and hopefully months. And actually the incoming Biden administration and their national vaccine program that they've outlined in the $400 billion package that they have put together is an encouraging sign, at least from my perspective.
Yeah, concretely on that, how will that help? There's billions in funding for vaccine distribution and testing and so on. So how specifically will it help? And maybe more importantly, even how long do you think it'll take for that help to sort of filter through to the system on the ground where you are?
Well, what I'm encouraged by is that they are going to invest in community clinics. They're going to invest in mobile clinics, and that's going to be critical because we want to bring the vaccine to where the people are. Some of them will be able to come into the health system, but some of them are socially disadvantaged patients, and they need to actually have the vaccine brought to them. The other big investment here is the public health infrastructure. We've been talking about this for the past 10 months. It's been hollowed out. This program is actually going to invest in getting 100,000 workers on the ground. We, the health systems, need that help. We need that public health infrastructure.
And finally, before I let you go, your organization sort of is part of a national chain, if you will. So you have, locations in different states. So I'm wondering, there's a vast disparity between how some of the states are doing in terms of the vaccination. Some of them are doing it at twice the rate at others. So are you getting a chance to sort of look at what works in states like Colorado, for example, and what doesn't, like here in Georgia, which I think has just distributed the lowest percentage of any state's doses?
What it really takes is actually getting around the proverbial table and having the health systems, the public health sector, as well as government officials actually sitting down and organizing this. I think of this as almost like a public health works organization like we did back in the Depression era, and actually getting everybody to roll up their sleeves and work together. The smaller states, and you referenced Colorado, have been able to do that. We need that kind of national coordination. And that's really what I think is going to get us over the hump.
All right. Well, you have such a huge task on your hands. I wish you the best of luck, and thank you very much for speaking with us. We really appreciate it. Dr. Stephen Parodi, thanks for joining us.
Thank you for having me.